So we have in-person participants and participants online as well. Can I just check whether online participants are with us? Aneta and speakers from FORUM. Yep, excellent. Great. So welcome back. That was a not too long break, but hopefully everyone could get some coffee and water, anything else. So the title of this panel is the role of the monitoring to address violence against women and children. We heard about the importance of defending the rights of persons with disabilities when it comes to violence, and especially to focus on children and women. So intersectionality in this subject is very important, and in this session we will reflect on some of the experiences of the Disconnected project partners when they conducted or will be conducting monitoring visits to address violence against women and children with disabilities. Not only in institutional settings, but in so-called community-based settings as well. I'm saying so-called because the UN guidelines on the institutionalization was mentioned during the previous session, and according to that guidelines, for example, daycare centers for persons with disabilities are not, so these centers are not community-based settings, but still the goal of this project, the Disconnected project, to visit, to monitor these settings where persons, where children and women with disabilities are facing or may be facing violence and other forms of ill treatment. So, with that in mind, I think we can start with a video which was recorded by FORUM, which is Validity's partner organization in this project and many other projects. And FORUM is an international human rights organization working in this region, especially in Slovakia and Czechia. And they are bringing cases to courts at national levels and also to the European Court of Human Rights and to UN treaty bodies. They are doing advocacy and conducting research activities. So if we can start with the pre-recorded video, please. Thank you.
Vážené dámy a páni, vítam vás na prezentovaní. Volám sa Martina Holantová a ja a naša organizácia INKLUB vás víta na prezentovaní expertov so skúsenosťou.
Čo sme robili? Monitoring v zariadeniach sociálnych služieb so zameraním na tému násilia. Navštívili sme spolu 5 sociálnych služieb v rôznych častiach Slovenska. Konkrétne domov sociálnych služieb 2-krát, špecializované zariadenie a zariadenie podporovaného bývania. Monitorovacia návšteva trvala 1 pracovný deň. Hlavnými metodami zberu údajov boli pozorovanie a rozhovory. Nezameriavali sme sa na dokumentáciu. Čo sme robili? Zloženie monitorovacieho tímu, právnik, sociálny pracovník, študent sociálnej práce, expert so skúsenosťou, expert na sociálne služby. Vždy bol minimálne jeden človek z týchto profesí v tíme. Veľkosť tímu sa pohybovala od 5 do 8 členov.
To sa nám podarilo. Jednou z vecí bolo to, že sme našli expertov so skúsenosťou, ktorí boli ochotní vyskúšať si monitoring v teréne. Tiež sme našli aj zariadenia, ktoré boli ochotné s nami spolupracovať. A konkrétne išlo o spoluprácu so 4 poskytovateľmi pobytových sociálnych služieb. Prebiehalo 5 monitoringov v rôznych pobytových sociálnych službách, ktoré nám pomohli odhaliť rôzne rozdiely medzi službami. A konkrétne išlo o deinštitucionalizáciu medzi jednotlivými zariadeniami a tento monitoring a jeho výsledky nám ukazujú smer, akým by sociálne služby mali na Slovensku ísť.
Do monitoringu sa zapojili aj naši kolegovia z úradu komisára pre osoby so zdravotným postihnutím.
Pracovali sme na monitorovacích nástrojoch v zrozumiteľnej podobe. To znamená, že pre lepšiu zrozumiteľnosť sme pracovali na monitorovacích nástrojoch, ktoré sú ľahko čitateľnom a jednoduchom jazyku. Overovali sme ich takisto v teréne. V zrozumiteľnom jazyku sme vytvorili aj prílohu správy z monitoringu.
Monitorovanie expertov so skúsenosťou. Ako prvé prebiehalo online stretnutie so zamestnancami pre ľudské práva.
Tréning na monitorovanie. Tréning na monitorovacie návštevy vybraných zariadení sociálnych služieb prebehol v INKLUBe v Košiciach. Rozobrali sme nástroje, monitoring, ako prebieha trestné konanie. Rozobrali sme si ľahko čitateľné príbehy.
Monitorovanie sociálnych služieb prebiehalo tak, že sme sa stretli s riaditeľmi zariadení a tí nám povedali, ako presne to tam funguje a poukázali nám aj prostredie. A potom sme sa ako kolegovia rozdelili do jednotlivých skupín, ktoré vlastne sa rozprávali so zamestnancami a klientmi.
Vypracovávanie správy. Týždeň po monitorovaní sme vypracovávali správu z monitorovania. Do tejto správy sme zadávali zariadeniam rôzne odporúčania, postrehy, čo sa nám páčilo, čomu sme celkom nerozumeli a tak podobne. Zameriali sme sa na viacero oblastí, ako je prostredie, kde konkrétni klienti žijú, bezpečnosť, spolunažívanie, takisto aj komunikačné prostriedky.
A na záver sme odovzdávali správu z monitorovania jednotlivých riaditeľom zariadení a tam sme poukazovali potom sme sa stretli na online stretnutí a prediskutovali rôzne negatíva alebo postrehy z monitorovania.
Toto monitorovanie nám tiež aj ukázalo, v čom sa môžeme ešte zlepšovať.
Mali sme málo materiálov, čiže nástrojov pre jednotlivých členov monitorovacieho tímu, málo času na monitorovanie, ale aj málo tréningu. Hlavne sme mali málo času na jednotlivé situácie v teréne a monitorovanie situácií.
Okrem toho sme tiež mali málo času aj na monitorovanie, keďže jedna monitorovacia návšteva v sociálnej službe prebiehala len jeden deň. Taktiež sa nám stávalo, že sme mali neoverené informácie alebo boli skreslené. Okrem toho sme zistili aj nedostatok vo vedomostiach o ľudských právach a taktiež ich východiskách.
Ďakujeme za pozornosť a príležitosť byť súčasťou monitorovania.
Thank you so much for sharing your experiences with us. And I cannot see you now on the screen, but surely you stayed in connection. Okay. So can I just ask you to please present yourselves to us, especially the forum team, so that we can know your name, although it was mentioned on the video as well, but please do that.
Takže vám sa predstaviť, alebo dobrý deň, sme radi, my sme vlastne INKLUB a toto je tým, ktorý sa zúčastnil monitorovania. Sme tu len nejaký čas, lebo kolegovia sú niektorí chorí a sme veľmi šťastní, že sme sa tohto roku zúčastnili tohto monitorovania a že sme dostali...
So, hi, my name is Lucia. I'm from Forum and I was cooperating with the experts by experience who just presented to you themselves. It's Martina, Adam and Iveta. And Martina was saying that the other part of the team is on a field visit or something else, somewhere else, but they are saying hello to you, and they are very happy that they can be the part of the monitoring and as well as the conference. So hi from the forum.
Thank you. And perhaps Adam, if I'm not mistaken, if you can say a few sentences about yourself, please.
Moje meno je Aneta Genova. Som rád, že som sa zúčastnil monitorovania. Ďakujem za túto príležitosť. Dalo mi to veľa skúseností a moje zdravotné znevýhodnenie je zrakové.
Hi, my name is Adam Pohanka. And thank you for this opportunity and for the monitoring experience. And my disability is the eyes. Thank you. I'm sorry, I'm just stepping in. Forum team, I will be translating you if you wish, but please allow me to translate you after the sentence you say, okay? Thanks.
Thank you, Lucia. And I think I would have just one more question to our participants with disabilities who really did a great job during the monitoring visit. My question would be, why did you choose to take part in the monitoring visits? Can you hear that, Lucia? Sorry.
Yes. The question was, prečo ste sa rozhodli zúčastniť sa monitorovacích návštev? Please unmute yourself. So we can hear you. Thanks.
My sme sa rozhodli zúčastniť monitoringu preto, lebo je to skvelá príležitosť, ale hlavne sme chceli poukázať na ľudské práva ľudí so zdravotným postihnutím a na ich dodržiavanie. Čiže toto bola pre mňa ako osobne skvelá príležitosť pracovná, ale aj taká osobná, keďže od malička sa zaoberám ľuďmi so zdravotným postihnutím. Lebo sama mám zdravotné postihnutie, čiže ide to mojim životom. A je to môj život.
Okay, so Martina was answering that it was a great opportunity to do something else, something new, but for her, it was the opportunity to get to know more and talk more about the human rights, basic human rights and the human rights for people with disabilities, because she is the person with disability from the date she was born, and she's developing more skills in this topic and wants to talk more about it also in Slovakia and also wherever is possible. So that was Martina.
Thank you. If Adam wanna also share some of his thoughts, thank you.
Adam, chceš povedať aj ty, prečo si sa rozhodol zapojiť do monitoringu?
Rozhodol som sa zapojiť, chcel som skúsiť niečo nové, čiže bola to aj životná skúsenosť a zároveň som chcel poukázať, že aj keď ľudia majú zdravotné znevýhodnenie, tak majú rovnaké právo žiť ako ľudia bez znevýhodnenia. Niekedy mám pocit, že ľudia so zdravotným znevýhodnením nemajú, ale majú menšie právomoci na život a chcel som poukázať, že to nie je pravda.
Okay, so Adam was saying it was also a great opportunity for him to try something new, but he wanted to point out that the human rights are for everybody, not just for people without disabilities, because he sometimes feels that people with disabilities in Slovakia are oppressed and they don't feel the same as the majority.
Yes, thank you for your help with the translation with Lucia. And it's really great that we have experts by experience with us today in this panel. We also have other experts with us. And let me turn to our experts here in the room and online. I would like to ask you to please present yourselves and say a few words about your organization as well. And my first question would be for you to tell us about how were the specific types of institutions or services selected for the monitoring visits. So like about yourself, the organization, and how you selected those facilities which you visited. First, I would like to give the floor to Lucia. Thank you.
I'm not able to translate.
That's fine.
Sorry, I'm Lucia, but I'm not able to translate, so I will speak in English. I'm from Portugal. Actually I'm not from the team. Sandra and Anna, they are not able at all to be present online, whether in present. So I'm passed their message the better I could. So FENACERCI is an umbrella organization for 15 organizations, another 15 organizations that have support services to people with disabilities, intellectual disabilities. So in that way it was easy to select the 4 organizations for this network that already exists, and is something natural with FENACERCI because FENACERCI developed a lot of national and transnational projects, and is some natural involve their associates in this project. So they were selected 4 organizations, and the criterion was the size, so have different size of organizations and spread for all country. One on the center north, another 2 in the big Lisbon region, and another one in the south, interior south. So was the criterion to select these 4 organizations, and well, it was easy. They accept.
So you wanted to visit like big facilities or smaller ones, because you mentioned that the
size.
Yeah.
The organizations in Lisbon, they are bigger. In the south, it's a small organization, and in the center, I think I can consider a medium organization. Yeah. So, and makes a difference, not only because of the size of the institution, but also the place where they are placed, the context, more rural or more citadine. So these make some differences. And also they have different services. So each institution, each organization have different services. Usually central of activity, occupational activities, residences, also teams that go to the schools and support inclusion in schools. So these different services, more in community or more institutionalized, also is important to implement the project.
Thank you so much. Can I just now give the floor to our Bulgarian expert here online?
Thank you, Sandy. Hi, everybody. Can you hear me?
Yes, we can.
Okay. So my name is Aneta Genova, and I'm from Bulgaria. I'm the project manager of Disconnected project in Bulgaria. And you have in the room 2 more colleagues from Bulgaria. The organization implemented the project is KERA Foundation. I am the founder of the organization. We are the same person, same people who established later a network of independent experts, NIE, which is a network bringing together lawyers, social workers, psychologists who are passion who want to work for defending human rights of people with disabilities. And monitoring is one of the most important tasks we have in the both organizations. back to your question about how we choose the service we visited. In our case, the size is not the most important issue because we wanted to follow our experience and follow the stories we know from before. For example, I'm in this field since 2005, and I'm doing monitoring visits since then until now. In our monitoring team, we have a person who is also person with great experience, Elena Krsteva, who is coordinator of the project. She worked previously in Bulgarian Helsinki Committee together with me and Validity Foundation, and she wrote about 20 detailed reports related to the situation in the children institutions. When we left Bulgarian Helsinki Committee, we prolonged our work with Validity Foundation, and we did a lot of monitoring visits together with Validity partners and other partners, international partners, and independently. So we have a lot of information outside of the public available information about what happened in institutions, group homes, psychiatric hospitals. So our aim in this monitoring visit, in our pilot monitoring visit, was to collect additional information what happened with children, now adults, whom we know from before. Because choosing this particular complex of services, we knew in advance that there are placed children who were in big institutions before. We knew in advance that they went through severe neglect in these big institutions. They were subjects of inhuman and degrading treatment in these institutions. So our aim was to check and collect and document whether these children, now adults, had received any support to overcome the trauma, the long-term institutionalization consequences, whether they have any specific psychological support to start independent living. So this is was what mostly affected our decision to go exactly in this complex of social services. It is, just to clarify, it's a complex of 2 group homes and kind of rehabilitation center. I have doubts to name it exactly in this way because it's quite problematic, but I have to speak too long to explain the problem. And also our next visits are focused to check particular information we received through our network of users, people who are working in institutions. We have particular information for violence in particular group home, so we are going to visit it.
Thank you, Aneta. I don't know. Okay, yeah, my mic is back. Thank you so much for sharing this with us. And the 2 colleagues who were mentioned by Aneta, Tanya and Venera, who are sitting here in this room with us. So hello here. Can I give the floor now to our other expert here in the room? Ugnė, please.
Yes. Hello? Okay. Hi, thank you. So yes, my name is Ugnė Grigaitė. I'm a research project manager and the co-owner of a Lithuanian non-governmental organization, Mental Health Perspectives. We work in the field of mental health, disability and human rights. The organization was established back in the year 2000, so 24 years ago. We're more of an advocacy organization. We don't necessarily provide services to people directly, but we work a lot with services development on both the policy level and on the ground, and including the monitoring in existing facilities and so on. Personally, I'm also currently a PhD candidate in a relevant field. I'm doing my research in researching responses of mental health care services to the needs of survivors of domestic violence, including women with disabilities. So that kind of brings me to the fact that our monitoring that we did within the Disconnected project differed slightly from maybe the rest of the partnership, because we chose to focus specifically on matters concerning domestic violence and how facilities respond to those type of situations. So the rationale kind of goes back to the fact, as we know, that at least 1 in 3 women experience violence, domestic violence, including intimate partner violence, through their life. If a woman has a disability, she is 3 times or at least 3 times more likely to experience that type of violence. And another third very important statistic that I would like to mention is that generally women who experience domestic violence, including intimate partner violence, are at least 3 times more likely to have a mental health condition or to develop a mental health condition. Therefore, a lot of users of mental health care services, women, are likely to be survivors of domestic violence. So the type of facilities we chose for our initial few visits, monitoring visits, were psychiatric facilities and mental health care services in Lithuania. And we wanted to see how they respond, how they recognize, first of all, do they recognize that their service users, their patients may have experienced domestic violence or are experiencing it at the moment, how they then respond to it, and what mechanisms, if any, exist to address this problem in the healthcare sector. But then as we went along the way, we decided to go to the social care sector as well, to include a couple of community-based social care facilities, but those were independent living homes. So again, they were not large segregated institutions, they were independent living homes. But again, the issue of domestic violence was very important here, because often people who live in these type of facilities are not necessarily protected by the domestic violence law or the protection of domestic violence law, even though it's their domestic environment. So we also wanted to look at that. So yeah, we did our monitoring in a few psychiatric facilities and in a couple of independent living homes. So from both healthcare and social care sectors.
Yeah, thank you. And it's so great to see how diverse the background can be when it comes to monitoring these sort of facilities. Just want to give the floor again to, we have 2 more experts with us, or people with us. Now from Slovakia. Lucia, can you please take the floor now?
Yes, but I think Martina and Adam are also capable to answer your question. So
yeah, definitely. If they can
go on if they want.
Sure.
Takže my sme sa inštitúcie sa rozdielovali do 3 skupín a do veľkokapacitných, inštitucionálnych a komunitných. Ja som bola 9 z tých komunitných.
Okay, so we were in 3 groups. We chose the big institutions as well as the community services and then specialized services. And I with Ivetka went to one community-based services, but before it was an institution. So I would just add to this answer that that was our aim, to focus on the maybe some changes or differences between big institutional and then community-based services. Would you like to add something more, Martina?
Mne sa to veľmi páčilo z mojej strany, kde som bola ja, tie služby komunitné a väčšinou sa nás pýtali, že odkiaľ klienti, že odkiaľ sme a čo tu robíme a sme im to vysvetľovali, tak aby to pochopili v zrozumiteľnom jazyku.
Okay, so I liked it very much that we were in the community-based services, because the clients were talking to us and they were curious about us, where we are from and what we are doing. So I would add also to this answer that we went to the middle part of the Slovakia and to the eastern part of Slovakia. We were avoiding the capital city and the surroundings, and the institutional care services were very big. They were for 120 residents. One of them was just for women. And then the community services were for 50 to 70 people, but they were living in a group homes. One group home has 6 inhabitants. So that's us.
Thank you, but I still would like to ask you, Lucia, to present yourself. And we also have a colleague sitting with our 2 experts by experience in Košice. So if you can just present yourself for us to know you.
Yeah, I'm from the Forum for Human Rights, the Slovak partner, and you were talking a lot about Forum, so you already know. But I also I am the director of another NGO based in Slovakia and established just after the communism fell. So we are 34 years old, and we are called Social Work Advisory Board, and we are dealing with systematic changes in Slovakia, and we are the main partners for the ministry and for the government in the field of the institutionalization and then services based on PCP, so person-centered approach, and individual planning and quality of services. So that's me. And the third person sitting in Košice is Aneta Genova. She is a student of pedagogic faculty in the University of Prešov, but she's also the personal assistant to Martina, and she's also our colleague and the monitor from the monitoring visits.
Yeah, thank you so much. Thank you for that. So now we had the first round of questions, but I would like to share with you, but perhaps you are worried that we are behind schedule. So don't be worried. We will have lunch. We will have lunch at around 1 p.m. So you just need to wait like 40 minutes and you will get lunch. So I'm aware of that, and we really try to stay on time. What else I wanted to announce? Perhaps nothing else. Just want to add that when it comes to Hungary, we are planning to visit daycare centers in Hungary in January, and Zsófi has already set up like a few of these visits, all the 5. So it tells me that we will have a really rich data and information when it comes to monitoring those facilities where children and women with disabilities are facing or may be facing violence. So I'm sure that the Disconnected project will really bring like important results, and the outputs will be definitely very important and useful. Can I just ask my second question to all of you? And that is, that comes from our experiences in Hungary, that many times when we are organizing monitoring visits, we are facing challenges. It's hard for an NGO in Hungary to get into an institution, to get into, to monitor a social service. what sort of challenges did you face when you were organizing your monitoring visits, or even during the visits? If you can share some of those challenges, and how did you manage to address these challenges, to overcome those barriers? Can we start now with Ugnė?
Thank you. It wasn't as difficult for us as for you in Hungary to get access to institutions, to facilities that we visited. The main point of call was to approach the director of the service directly and to tell them what we would like to do, invite them to collaborate. So the ones that did accept us were very open to collaboration, to finding out what they can do better, what gaps there are, how we can improve it. But a lot more refused access. So the main practical reasons, the main reasons they gave us why they're refusing us was practical. They said they didn't have the capacity to accept us because we wanted to interview staff. They said, we don't have enough staff, we're overworked, we don't have time. And it was kind of mostly based on that excuse. The ones that did accept us, were very open. What other challenges? It was a challenge to find enough psychiatric facilities who would accept us. So that's why, in the end, we thought of this second option of independent living homes. So to be completely honest with everyone, that's how it happened, even though we're glad it happened because we found this other loop and gap that exists within the independent living homes. But yes, a lot of psychiatric facilities didn't see the relevance of monitoring matters concerning domestic violence, because a lot of mental health care facilities don't see domestic violence as a medical issue, even though it is a very big public health problem. They kind of think it's a social problem, doesn't concern mental health care. So they would just refuse it like that, or others, like I said, would say that they didn't have time or resources. So I think that was our main challenges. Maybe others will have something else to add.
Yeah, and during visits, did you face any challenges when you were on visits?
To be honest, not really.
Not really?
Not really, because the facilities who accepted us were really open and enthusiastic. They wanted us there. They wanted to know what we find. They wanted to know what they could improve. So unless my colleague remembers any challenges, no. Well, sorry, I don't have anything else to say.
Yeah, thank you so much. I don't want to actually force you to say what hasn't happened, but cooperation is really key when it comes to monitoring visits, for sure. Other colleagues, can I just now turn to our colleagues from FORUM? What sort of challenges did you face when you were organizing the visits or during the visits?
Would you like to say something, or you will just add the things after I say? You are unmuted.
Tak návštevy, ktorú som sa zúčastnila ja spoločne s Martinou, tak bolo komunitné centrum, ktoré nemalo problém s tým, že bolo oslovené, pretože sme im ponúkli aj konzultácie potom k tým zisteniam.
So the facility we visited had no problem to accept us and to cooperate with us because of the reciprocation. We offered them then consultation based on our findings from the visit, and we offered them also support with other challenges. So they accepted us very well.
Ale problémom bolo to, že tieto centrá sa nachádzajú väčšinou na odľahlejších miestach a bola tam trošku ťažšia doprava.
But the problem was to get there because of the remoteness of the areas, and So we had to challenge the transportation issue.
Ja chcem ešte dodať, že keď sme prišli do sociálneho komunitného zariadenia, tak klienti nás brali ako klientov, lebo nechápali to, že som na vozíku a idem niečo pracovať s nimi, niečo sa ich pýtať. To znamená, že ich budem monitorovať. Oni tomu nejak nerozumeli. A to sa stávalo aj v iných inštitúciách, ktoré sme navštívili všetci, celá skupina.
This is the great input from Martina. What happened during the visits and the challenges during the visits. So when the expert by experiences came, and it wasn't just Martina, it was all the others too, the clients from the facilities thought they are new clients. So they started to handle them like so. So this was difficult to explain them that they have different role in the facility, but on the other hand, it was also good because they didn't have the barrier of the communication based on the feelings that they are the same. Anything else?
Bali vlastne prostredie bolo bezbariérové z našej strany, ale niekde, kde boli moji kolegovia, tak tam niekde neboli. Takže mali problém, boli tam schody, alebo musel môj kamarát vynašať svojho užívateľa, že musel pomôcť sa tam dostať, čiže to bolo problematické.
So Martina is talking about the accessibility issues. They didn't have particularly there the accessibility issue, but the other colleague has to be had to use the stairs, and he wasn't capable of it, so it was quite difficult for him. And yeah, that's true, because some of the facilities, especially the institutional ones, they are based in the old buildings, old mansions. They didn't have the accessibility issue solved in all the places. So that was the other thing.
Thank you. Would you like to add anything else to that?
No, I think they answered pretty well. I just add that, as Ugnė said, we didn't have the issues to get to the facilities into cooperation as well, just because of the approach of offering something in return, and also that we had established some kind of contact and relationships before the visits. So Slovakia.
Yes, can I just ask a question? Do you think that you can, I mean, you said that you offered something in return. Can I just ask whether you think that you can still be critical when it comes to giving feedback to the institutions? I mean, even relying on the UN guidelines on the institutionalization, and to tell them that institutions are segregated facilities and they are just their mere existence is a violation of the CRPD. Can you give that feedback to them?
Yes, and that was we decided to give each of the facility their own report with the recommendations and with the findings, and this was the main finding in two of the big institutions, that they should be closed and deinstitutionalized. So yes, but on the other hand, they are on the way of the institutionalization. So they just started, but they are on the way, so they understand what they need to do. So yes, we were critical, but then we also offered help and assistance in some of the things we discovered, such as, I don't know, from mold on the ceilings to approach of some of the employees to the clients. So yeah.
Yes, thank you so much, Lucia. That's I think very important to, if we stay in touch with the facilities visited and to provide them with help and assistance. Yeah, can I just turn now to Lucia now in the room? Thank you.
So the barriers, so they were involved already. So in the context of the past experiences, and collaboration was not a difficulty to have their collaboration. But of course, the directors say, yes, we want to collaborate. We want to learn more about that. But then it's necessary the organization get the same vision of the project. And there is more actors involved, so it was important to make one meeting before the project start, one meeting with all the institutions participating and explain exactly the vision of the project, the goals of the project, and the challenge to form these internal monitoring teams. And I think this moment, initial moment, was important to kick off and motivate to participate in the best way in the project. But yes, they were open. But let's see in the future, you know, because more deeply we go in the project, more actors we touch, and of course the project is an ongoing process. So I believe some resistance and barriers will happen yet.
Thank you. And did you also face the problem which was mentioned by Ugnė, that okay, the director was available to talk to you, but whether other employees of these facilities, did you have access to those employees, like workers, and or they were like really on duty and they didn't have time?
So the project team only held one meeting so far with one institution. Oh, right. And during this meeting, several persons were in this meeting. So the director, but also one technical for one services and a person with disability. So it was more representative of the institution. Yeah, but of course this is important because the top down but bottom up, the two ways are important when we want to implement a project like that. But because otherwise it's not an organic project. Doesn't work. So this is an important issue.
Yes, thank you, Lucia. And now, Aneta, please, if you can share your experiences in Bulgaria.
Yes, of course. By the way, you have in the room Aneta Genova, who has great experience in organizing the visit. But I was in the break, you can discuss if you want with her experience, but I will share mine. The challenge we have relatively new legislation in Bulgaria, Social Services Act, which allow to the civil society to visit, to exercise kind of monitoring in social care services. It's not very well described. It's not very clear. We cannot just go there and visit and make an announcement visit. We have to negotiate in advance. We have to ask permission to explain our visit. For example, when we went in our first group of institutions in the scope of the project, we explained that we are implementing new methodology. We openly explained this, and we were very well accepted, actually. In the beginning, everything was very well during the visit, but in one moment, the director realized we are noticing problems, especially in the second group home which we visit, where we had a problem to access all rooms. We had problems to make notes even about the documents. We made some restrictions in one moment. When they realize we start to notice problems. And I think it's happened because in Bulgaria, the only few organizations are doing monitoring visits in group homes, ombudsman office, but they haven't capacity to visit all of them. Also, Bulgarian Helsinki Committee have some monitoring visits, our organization, and the rest is only government bodies. And some of the institutions, group homes, they are living with the false impression that there is no problem in their services, everything is fine, they are just excellent, and they expect to us to confirm this. And when we start noticing problem, it's became a kind of it's challenging for them to accept this. So during our visits, for example, we have under the control of the director most of the time, especially second part when she starts to realize that we are noticing a problem. So yeah, there was challenging it was quite challenging to give her honest feedback even, and to be heard because they are living in kind of balloon that everything is fine, and they accept feedback very very hardly.
Thank you, Aneta. Yeah, Ugnė, yeah, come in.
Listening to all the partners, I remembered a couple of challenges that we had, which were actually quite important. So responding to that question about giving honest feedback, and the problem, well, it wasn't a problem because from the methodological point of view, from the start, we kind of decided to do it that way, but we did focus on domestic violence and not institutional violence. I think had we focused on institutional violence more, even though the institutions we visited were not like the worst in the country for that risk, but still, I think they wouldn't have been so open. Yeah. So we had, but it's good to narrow your scope, and the domestic violence aspect was very important, especially in the mental health care facilities. But still, you could see it as a challenge because we couldn't actually do a full-blown monitoring of all types of violence that may be relevant in this case. We did look at the internal policies related to prevention of violence inside the facilities. We try to review everything that's possible, but yeah, there had to be some sort of adapting to this reality. And the second very big problem we had, which we still actually don't know how to address in the future, because it's an ethical issue due to which we couldn't interview the service users. Because especially in the healthcare facilities, they are in a healthcare facility receiving healthcare, mental health care, and we want to ask them about experiences of domestic violence. It's just completely unethical, and secondary victimization, all the horrible things that you can think of. So in the end, we only interviewed staff. We didn't speak with the service users, which would have added another layer of some important information. But like I say, we just adapted to all these challenges and did what we did, which still provided a lot of important results, which hopefully can be used to improve services.
Yes, thanks, Ugnė. I think that's the key. I think that's very important when it comes to interviewing, like those persons with disabilities, those women and children with disabilities who are getting like so-called services in these facilities. And I think my last question would be about that, because I think that's really key. And then the floor will be open, so you can also ask questions. It is just, I mean, to me, I mean, out of curiosity, that I did so many monitoring visits, but the topic of this project is really like, how to say, sensitive. So so it's easy to monitor accessibility in a service provision or in an institution. It's easy to monitor whether they can complain. That's easy. But monitoring whether children and women with disabilities were facing domestic violence, institutional violence, gender-based violence. This is really a hard topic. So what do you think, or like, what is your, how did you manage to address this specific challenge? Did you manage to, of course, I mean, like, I can imagine that when you are like drawing a list of questions, those shouldn't be all of them about violence, because that's really traumatizing. But to ask questions and to include some questions at least about this specific topic. So like, just ask you, how did you deal with that? How did you address this specific challenge to get information about gender-based or domestic or institutional violence? If you can share some of your experiences concerning that. Aneta, can we start with you now?
Yes, of course. Yeah, it's really very interesting. And in the beginning, I also didn't realize where exactly is the difference, because we are always asking about violence, including sexual violence in the institutional settings. But doing this project, we realized that our task is going behind the current moment when the person is placed in institutional settings. So we usually ask about how the person end up in the institution, how it's happened for him or her to be placed in the institution. So what happened before institutionalization? In many cases, we hear stories about gender-based violence happen before the placement in the institutions. For example, we hear a lot of stories, even during our last visit. We hear stories about placement in institutions, in a group home, in this case, as a protection, as a measure of protection after a girl went through a sexual abuse, for example. In this particular case, she was placed there because she was abused in the family, and the measure the government, the social care department took was to place in these particular institutions. She was a girl without disability, or she was considered as a girl without disability, and she was supported a lot from the director of the group home. During our visit, she wasn't there, but we hear her story as something very positive. In my opinion, unfortunately, it wasn't so excellent example, because actually she never received special treatment, special rehabilitation, like a psychotherapy or something like this, to overcome the consequences of the sexual abuse she went through. The consequences of the abuse were considered as behavioral problem mostly and treated like this, which is very problematic as well. So the consequences of the trauma weren't addressed properly in this case. In another case, we met a boy who was a victim of domestic violence before to be placed in the institutions. Then he was placed in a foster family where she was victim of violence in the school, kind of harassment, and then he was placed in the institution. We noticed and he explained us very clear some consequences of the trauma he went through, like he afraid from any fast movement, especially behind his back and so on. Very clear signs, but the personnel in the group home didn't recognize these signs. They neglect his trauma, which was very painful for this boy. We had chance to have a conversation with this boy in very face-to-face. I had this conversation with him, and we decided with him to share with the director his problems, his trauma, and what he suffered from in the institutional settings. But clearly the director didn't understand this as something problematic. She told us he just has fantasies, he doesn't understand, it is not a problem. So it's very clear from this story that the services haven't any knowledge how to address previous domestic violence. And it is a way to make the trauma even deeper. It's a way to second victimization of the victims. It's very traumatic and repeating traumatic experience, which leads to very serious consequences for the victims. It's I wanted to share only these two examples, but I have to say we have this experience everywhere. Domestic violence is not well recognized and not properly addressed in the social care services, even those based in the community, like rehabilitation centers, like consultation centers, because there is no proper education in, especially in Bulgaria, there is no proper training to the social workers how to address these issues. The services are clearly separated, and there is no access for a victim with disability to the general victim support services. This is our conclusion after this part of the project.
Thank you, Aneta. Thank you. Can I now bring in our colleagues from Slovakia? Thank you.
I can answer and you can add, or is it okay? Okay. So what I have to say is what was also on the presentation, that we didn't have enough time for going so deep in such a very sensitive topic. But we focused on both institutional and domestic violence, and in several cases, the clients were able and willing to to tell us about the situation that occurred when they were visiting home. So this was what we have documented and then talked to the staff and then asked for the measures that and the actions that have been taken or have not. So that was the one part. And for the institutional violence, unfortunately, in one case we were able to see inappropriate behavior from employee towards the client. So we immediately talked at that day to the director and asked about the situation and how it will be handled. So the employee was prosecuted with the salary freezing, and there are some actions that might follow. It wasn't so strong that we had to report it, but we were talking with the director about that. So these two particular things were occurring during our visits. Maybe you want something to add something, Iveta, Martina, or Adam?
Yeah, if I can. Maybe it seems like the monitoring was easy. If we take a piece of the paper and we think of the options like have stairs and have enough clothes, food, but there was the difference when we had to focus on social relationship.
Pre mňa osobne ten monitoring bol o niečo ľahší, keďže mám zdravotné postihnutie, lebo klienti boli ku mne otvorenejší, keď ma videli, lebo si mysleli, že po celý čas monitorovania, že som nejaká nová klientka.
So Martina is saying that the topic and the handling of the topic was a little bit maybe easier for her to handle because of the feeling of the clients that she's a new one coming to live with them. So they were very honest with her and they were telling her a lot of stuff. Then we try to talk with the staff, supporting staff, about it to confirm it or to have any additional informations, and then we wrote it to the report. Anything else?
Zistila som, že jeden z klientov mal rád veľmi hudbu a zaoberal sa hudbou, čiže zistila som viac informácií tým, že u mne klienti boli otvorenejší, keď otázky na súvislosti jedla, oblečenia alebo nejakých zážitkov.
So Martina is adding that she was able to gather more informations overall within the interviewing with the clients. And what I have to add is that she was also talking about the not violence as well, but the food, the quality of food, the environment, the communication, the freedom to roam, to left the institution and so on. So these was also topics we were focused on, and she was able to gather more and more information about it. Okay.
Thank you. What I would like to add to that is that my experience is the same. Like when I went on monitoring visits with persons with disabilities, like experts by experience, my experience is that residents of institutions, they open up more easily if there is someone with disabilities in the monitoring team. So that's a very important thing. Lucia, can I bring you in now?
One meeting, but the team project, I told about the methodology because these are difficult conversations, of course. And the methodology they told about create psychological safe space to these conversations happen and start be clear about that we are here to be honest. So we are learning and we are collaborating, and it's a process of co-construction of something that it's important because the numbers are there and we have to talk about the numbers that we just heard this morning. And this is important to talk and then go inside. This happens inside doors. So then we have to identify. And yes, there are different difficult conversations, but I think if these monitoring visits are done in a pedagogical way, and it's not in terms of compliance, but in terms of resilience. So we are not going by shame, but create resilience in the institutions, so we are able to make sure that this doesn't happen, and when it happens, someone knows how to behave. So I think this is the way this team wants to go through.
Yeah, definitely, and to prevent.
And to prevent.
To prevent. That's important. Ugnė, would you like to add anything to that? Because we started with your.
Yeah, so with the challenge that this time around we couldn't really interview, especially, like I said, the patients in healthcare facilities. I think, again, as I was listening, I realized and remembered what the difference was, because we have done a lot of other human rights monitoring in Lithuania, in other types of institutions, long-term care institutions, for example, where we would always interview residents, of course. And it's a very important part of it. But the difference this time was that it was a short-term healthcare facilities where people just come, especially in the inpatient psychiatric facilities. It's people in a lot of distress already, short-term care, and then our monitoring wasn't even a very broad scope, like checking the food and all other maybe physical things. It was specifically about domestic violence. So it was really inappropriate to come and try and talk to a person who's in a psychiatric hospital, basically, for a short term about the experiences of domestic violence. So it was different in that sense. However, I also realized that we have anyway addressed this retrospectively, because in another project we did research where we did an open call to people who would like to share their experiences of when they went to mental health care services in the past after they experienced domestic violence, and to share the stories. So we do have that, and that will be published soon. So I guess maybe that's the only possible way to hear those voices, because to actually try and approach people here and now whilst they're in an extremely vulnerable situation in distress, it's not really appropriate or ethical. So that's it, I think.
Yeah, thank you so much. And honestly, I wanted to give you the floor, for questions, but we managed to ask so many questions to our experts, and it's 1:00. We still have 1 minute. So if you have just anybody in the room, one question, please formulate it in a very brief way, or if you would like to add something to the discussion we just had, you have a little time. No, nothing in the room. Yeah, so then in that case, just to stay on time and really not to keep you away from the lunch, which is hopefully already prepared outside. So I thank you, all of you who joined us for this session. Ugnė, Lucia, Adam, Martina. Thank you, Aneta. So thank you so much for taking part in this session, and have a nice rest of the day and the rest of the session for us.